Hello, Marteen Santerre here with Soul Being, and today I'm speaking with Dr. Sean McCloy.
Hello.
Sean is dual board certified in family medicine and integrative medicine. So today, we have Thanksgiving coming up, a time when people love to just eat, myself included. You probably too. But we're going to talk a little bit today about functional medicine and gut health, because those topics go really well together. And so can you tell us a little bit about how functional medicine treats the gut?
Sure, that's something I see pretty much every day, is people who come in with complaints of things like irritable bowel syndrome or just a belly that's not quite right. And we're seeing more and more connections in the scientific literature between our gut health and the health of the rest of our body. Yeah. So really all health and all disease starts in the gut.
Everything starts in the gut. Okay,
That's
so
right.
Can you give us an example of maybe a patient would have a particular gut issue, like you talked about IBS or something like
Sure.
that, and how you approach it?
Think of a patient I saw last week who actually had Lyme disease and was treated, I think about 2 years ago now, with several rounds of antibiotics. Her Lyme disease did get better, but ever since that point, she's had a lot of symptoms consistent with irritable bowel syndrome. Okay. So things like abdominal discomfort, bloating, gas, alternations between loose stools or diarrhea, constipation, just not quite being able to have a good regular gut health. Mm-hmm. And she had seen several other practitioners, saw her primary care provider, even had a colonoscopy done through a gastroenterologist. All of those tests were normal, but she still just wasn't quite right.
Yeah.
So she came to see me and was exploring other options, and we did a couple of tests. One was a test called a hydrogen and methane breath test. Okay. She did this at home.
Okay.
We're looking for something called small intestinal bacterial overgrowth, or SIBO. That's an overgrowth of the bad guys in the small intestine.
Okay.
And there's another test she did with a stool panel looking at the function of her gut. Was her stomach making enough stomach acid to digest her food? What was going on with her pancreatic enzymes, her bile acid production, the balance of all the good guys and bad guys in her gut, markers for food allergies, food sensitivities, inflammatory markers. So a very comprehensive test. Okay. She did all these tests at home, took about 3 weeks to get the examples back, the results back, excuse me. And it showed an overgrowth of some pathogenic bacteria, so some bad guys in her gut.
Now, had that been affected by the antibiotics that she had taken before when she had the Lyme?
That was our guess,
connection?
That's right.
Okay.
So the antibiotics did their job. They killed off the Lyme disease, but they also killed off a lot of the good guys. And that sometimes allows these bad guys to take over and cause symptoms.
Wonderful. So what's the resolution for that patient in that situation?
It was kind of neat. With this test, we actually got a sensitivity panel. So the test told us which antibiotics would be the most effective if we wanted to use pharmaceutical antibiotics, as well as which natural herbal options would be most effective for her bad guys.
Got it. So she could really look at two different approaches.
She had some choices.
Yes, that's good. And so were there other dietary changes that she had to make?
Well, yeah, we often will recommend an anti-inflammatory diet. So that's using foods that have a whole lot of nutrition in them, whole foods, cutting out the sugar, cutting out the processed foods. There were some specific examples that I gave her.
Okay. So what's a good other specific example about anti-inflammatory foods? Like, is it red meat, or obviously macaroni and cheese in a box is probably not the best choice.
Yeah, exactly, right.
Well,
Mark Hyman has a simple rule. He says if you look on the label, if it has more than 4 ingredients, just put it back on the shelf, because now it's not a food anymore. It's become a Franken food, and it's just processed and doesn't have any nutritional content anymore.
Okay, all right, that's a good rule. So lastly, Thanksgiving obviously is coming up in a couple of days, and many people will be eating and will probably experience some gut discomfort. So can you give us one tip for getting through the Thanksgiving meal without just totally stuffing yourself?
Sure. Well, one quick tip that you can do on Thanksgiving Day, and really every day if you'd like, is just to prevent overeating. Yeah. There is a hormone that our stomach makes that talks to our brain that says we are full. It's called somatostatin. And it takes 20 minutes for that hormone to reach the brain from the stomach. So to slow down your eating, instead of shoveling all the food right in, what I recommend is take a bite of food, set down your fork on the table, put your hands in your lap, and chew that bite for 30 bites, swallow it, pick up the fork again, take it, put the fork back down, and just slow it down. Do a little bit of breathing. That really helps.
All right, awesome. Thank you so much, Dr. McCloy.
Thank you. Happy Thanksgiving,
and
be well.
Happy Thanksgiving.